Thank you so much for having me. I haven't prepared any slides, as I just prefer talking. And if anyone has any questions, like during me speaking, like just don't hesitate to ask. So I think it's important for me to start that I have now 29 I'm 29 years old, and I was diagnosed 4 years ago with pancreatic cancer. It was just like 2 months before my 25th birthday, so I was 24 at the time. And it was actually July 2019. I remember that, 2017, sorry. I remember that very, very clearly because I was just after finishing my last year of psychology, and the only thing I had in front of me was to get my master thesis and to defend it, and to actually become a major in psychology. And then I just got my diagnosis, and every plan and every thing go like on the other side. So it was July 2017, Wednesday. I believe we remember those like traumatic events very, very detailed. I got something like that. And it was when I heard my doctor saying that there is something big in your abdomen. She couldn't really see my pancreas, so she wasn't really sure what it was. So she advised me to have a CT scan as soon as possible. And I remember that after leaving my doctor, I just called immediately to arrange CT scan, and then call my parents who were on vacations at that time. And I was like extremely chilled and not understanding the seriousness of the situation, not knowing what's going on and everything. So I just actually I didn't have any everything was okay. I wasn't feeling bad. I just went to my doctor to get some help on and advices, because I wanted to lose some weight, but doing this very like in a good way with some tests and everything. So she advised me to have some blood tests, like more advanced and everything, and she also suggested ultrasound, which she performed. And then she found a mass of 17 centimeter inside me, so it was quite big. My parents came back from vacation this evening, and that was the first moment where I realized it might be serious. And I had a CT scan next day. And while waiting about like 24 hours for results, I got another ultrasound conducted by some friend gastroenterologist, and he confirmed previous result. And a few hours after that, I received the final confirmation from CT scan saying that I have 17 centimeter tumor coming from tail and body of my pancreas. And it was actually Friday after my work, and while I was working the whole day on Friday, my mom and her sister, who is a palliative care nurse, which was like, I was very lucky about that, they organized kind of a command center in my home. They were searching for best surgeons in Poland, best hospitals, best options, making calls on all of the appointments. I like calling my mom kind of the manager of my treatment and healing and my health. So when I actually get back home from work, I already had visits set for next few weeks, and everything was planned. So we've decided together with my parents and my family that I wanted to be treated in a clinical hospital in Katowice, which is a big city in Poland, about like 200 kilometers from where I lived. But a lot of sources said that it was the best place to have pancreatic surgery. And the surgery was actually set on September 19th, so exactly two months after the first ultrasound and the first moment when I heard something was wrong. And during those 2 months, I had diagnostic laparoscopy in oncology center in Wrocław, and Wrocław is very near my hometown. which showed that I had neuroendocrine tumor. And that was actually my first stay in hospital and first surgery ever. So I was absolutely stressed about that. And evening before that, my best friends come to visit me in a hospital. So we spent amazing few hours just sitting and chatting in the corridor. So they chilled me a little bit. That helped me relax so much. And I also had my 24th birthday on September the 8th, and my family and my friends organized a surprise party for me. And that was the moment when I realized how loved and supported I am, how huge is my army of people. And I actually felt that I have to fight whatever comes because I have so much reasons to live, actually. And suddenly, actually, those 2 months passed and it was time for me to go to Katowice and have surgery. And I was literally scared so much of everything, of staying in the hospital, of surgery, of narcosis, of everything, of everything what might happen after surgery. Surgery took like 6 hours. The surgeons got the whole tumor extracted, and I saw the photos of the tumor after that, because I am this super active and very curious patient all the time, and it literally looked like a head of a newborn. It was like that kind of like 17 centimeters, so kind of big. I have no idea when it was inside me, but I don't really remember a few days after surgery. I know I was on morphine and other opioids to stop the pain, and I was sleeping a lot. And my parents were with me all the time because I needed like really help with actually everything, with standing up from bed, going to bathroom or anything. And I couldn't eat anything because there was the one and biggest side effect, actually. My pancreatic duct was cut and pancreatic juice was flowing out of my belly through like wounds from drains. I don't know if I explained it correctly, but that's how I'm trying my best. And because it happened because due to my young age, doctors wanted to save as much pancreas as possible, because I was 25, so we all wanted me to live as long as possible and as healthy as possible. So now I have 1/3 of my pancreas, only head of my pancreas, and actually it is still working, thank God, very well. So I don't have diabetes or anything like that. It works well. So this is another area when I'm super happy and I'm super lucky. Like the surgery was actually big and serious because I was like cut through my whole body, and actually now I have a huge scar, which was a huge problem for me at one time. Now I just treat it like my survivor sign, let's say, like a scar on my armor, kind of. Like my proof what I've been through, but it took me a lot of time to get on good terms with this, and I didn't have strength. I was in a huge pain actually, and not eating, with those holes in my belly and this pancreatic just flowing out of me, and I was getting feeling worse and worse every day, and I was still in a hospital, of course. And after 2 weeks after surgery, results from tumor came, and everyone was absolutely surprised because it says that it's a solid pseudopapillary neoplasm. So not the neuroendocrine like previous, like this laparoscopic biopsies showed, but this SPN. Thank God it didn't spread and get malignant as a whole. So I was said that surgery will do as for now. And actually, a few weeks after leaving the hospital, I had a first appointment with an oncologist, and I was told that there is about 50% of chances that it may come back. Of course, I'm not an expert in this matter, so I just listen to my doctors. So I'm still a little bit stressed, but still 2 weeks passed. I got my results, but I was still in the hospital, losing strength every day in every aspect. I was getting weak, physically, but also mentally. I've lost 12 kilograms in a few weeks. So that was the only plus, because I wanted to lose weight. So it happened actually, but not the way I wanted this to happen. But my pancreatic duct didn't seem to heal itself. So after about 3 weeks of actually really like literally not eating, because I wasn't eating nothing for 3 weeks. I passed out in the bathroom, and then doctors decided that I need some parenteral nutrition. So I received that in a hospital. And it was supposed to like help me to get some strength, and also let my pancreatic duct to heal itself, which didn't help, of course. Pancreatic juice was still flowing out of me like absolute crazy. So there was this decision, surgeons decided that I need ERCP procedure in order to place the prosthesis on my pancreatic duct, so it should speed up some healing. So actually after 4.5 weeks in a hospital, after surgery, I was transferred to Warsaw to another hospital to have this ERCP procedure. So after a few more days, and after 5 weeks, after 5 weeks after surgery, I was back home finally. It was like October or November. I don't really remember that correctly. And unfortunately, my pancreatic duct healed in January 2018. Like not healed, like the pancreatic just stopped flowing, but every 4 months I had prosthesis changed for a new one. And after a few procedures of 4 or 5 procedures like that, in January 2020, I had a prosthesis removed. Unfortunately, of course, it wasn't the end of my suffering. Let's call it like that. Like from oncological point of view, everything was quite okay. I had very regular meetings with my oncologist, and all of the tests, CT scans, MRI, and everything was like okay from this oncological point of view, and from surgeon point of view. But suddenly, a few months after removing this prosthesis, I got acute pancreatitis. So I've spent another day in a 10 days in hospital in my hometown. And after that, I needed to add another appointment to my schedule. So gastrologist this time, gastroenterologist. So I like to call it a hat trick. I got my surgeon, oncologist, and gastrologist now. And we are like one big happy family. And I'm so lucky to have those amazing doctors around me. And of course, adding to this, my GP, the doctor who actually get me the first ultrasound and got the diagnostic path started. She is like my angel, guardian angel. And that was this moment after this, the first acute pancreatitis in 2020. That was the moment when I was doing my best to live a normal life, kind of like pre-surgery and pre-cancer. I didn't have any oncological issues, and my pancreas was healed as I was told, but I had this acute. And in a year time, actually, I had about 3 or 4 episodes of acute pancreatitis. So doctors said, like, not everything might be actually okay. So I was sent to some more advanced diagnostic, and MRI of pancreas and pancreatic duct shows that actually this duct is not okay, and that pancreatic juice is not flowing properly. Of course, there are some deposits in it which cause this acute pancreatitis. So actually, in October last year, I spent 2 weeks in hospital. And I was withdrawn just before COVID happened in hospital. And a few days after coming home, I got another episode of acute. So in those 3 weeks, I had 2. And it was treated at home because hospital was closed due to pandemic. And a year ago, at the beginning of November, exactly, I was sent to hospital in Warsaw, and I had ERCP procedure again because my pancreatic duct is definitely not healed. And now every 6 months, I'm going to Warsaw for this ERCP, and another one is coming in the beginning of December, actually. So oncologically, I may be okay, but the truth is I'm not sure that I will ever be like physically okay, actually, because I was told that surgery to fix this pancreatic duct is very unlikely to happen because of difficulties. and I'm actually searching for some ways to have it done, to have a normal life in 100%, because I need to be extremely careful with my diet and nutrition. I need to be very organized, always trying to think and predict what might go wrong. And even when I travel somewhere, I always have in mind that I need to know where is the nearest hospital in case of anything happens. So I need to be really aware and conscious. So yeah, as Vasiliki also told, I'm a psychologist and also psycho-oncologist, which actually happened after I was, let's say, coming back to my normal life, when I decided it's time for me to actually get a major degree in psychology. And then I decided to write my master thesis about psycho-oncology, and then decided to join psycho-oncology as postgraduate studies. And I decided that I can just use my knowledge and my experience to share it with patients, or to actually support another patients if necessary. And actually, I believe that mental health is extremely important in treating cancer and in living with cancer, actually. So during the whole process of diagnostic and treatment, I was supported by psycho-oncologist myself. This lady helped me get through this, actually helped me understand my emotions. She was giving me some practical advices, like, for example, what to ask any doctors about, what could happen, what to expect. And I think I get through this thanks to her, actually, because there was the moments when I was lying in a bed in a hospital, and I was actually just thinking about what's going to happen and all of the worst scenarios. Because I was extremely supported. I got support from my family, from my friends. They were all the time with me. But in the end, the patient is all by himself or herself, and that I think that's the worst thing in any disease. That in the end you are just by yourself. So now I'm trying to give some knowledge and some support to other patients, working with Europol Poland, and also Pancreatic Cancer Europe and European Cancer Organization, just giving a little bit of myself, actually, as much as I can. And after about this long distance kind of side effects of cancer, I was about a year and a half ago, I was diagnosed with depression. And I am now in psychotherapy, which helped me a lot, because when I was feeling physically kind of okay and coming back to work and starting my life and everything, I was actually hit by a train with everything what happened to me, and I couldn't really get through this myself. I've tried very hard, but I needed some professional help. So now I feel like I've dealt with all of those emotions and everything that happened during diagnosis and treatment. But the beginning was extremely, extremely hard. But now I'm in this good place. Now I feel like I'm coming back to life, actually. And it was 4 years after the tumor was resected. So sometimes it takes a lot of time. Yeah. So thank you for hearing my stories. I hope it was at least a little bit interested for you, as I'm always stressed about talking about myself, and I don't know if anything I'm saying is in any way interesting and helpful.